Chronic kidney disease. Chronic kidney disease in Indigenous Australians. It is evident that Aboriginal and Torres Strait Islander peoples experience poorer health outcomes and have a lower life expectancy than the rest of the Australian population. The greatest discrepancies experienced are with chronic kidney disease, with Indigenous Australians 7 times as likely to receive treatment for end-of-stage kidney failure compared to a non-Indigenous person. The background influences on Indigenous Australians' health include social, physical environment, and socio-economic determinants. Indigenous Australians are likely to experience poorer housing, environmental, and overcrowding. Often these environments do not satisfy the basic requirements of shelter, safe drinking water, and adequate sewerage. They have non-functioning sanitation systems such as poor water, air, and sanitation quality. Overcrowded and rundown housing is associated with poverty and contributes to the spread of communicable diseases. Indigenous health and inequality is determined by many interconnected social factors. During colonisation of Australia, racism was pervasive. Indigenous people were forced to live in missions and on reserves with freedom to hunt, socialise with relatives, practice traditional ceremonies, and marry were restricted. Segregation and assimilation policies were introduced, along with institutionalisation and geographical restrictions. In some instances, Indigenous people were prevented from speaking their traditional language, practicing their culture, and teaching their children their history and traditions. The restrictions and conflict associated with colonisation led to loss of liberties and life, and often altered Indigenous Australians' culture and social behaviour. Past atrocities and continued discrimination have created long-term physical and psychological effects on Indigenous people that are often transgenerational. This reflected in numerous statistics and psychosocial circumstances that indicated that discrimination and racism towards Indigenous people still affect their lives. For example, unemployment rates reveal a disparity with 17% unemployment for Indigenous people compared with 5% for non-Indigenous. Daily stressors related to such economic disparity also contribute to health issues such as chronic kidney disease. Socioeconomic circumstances, including economic hardship and unemployment, diminish the financial resources available to fund health needs. Financially challenging circumstances are psychologically distressing and compound the Aboriginal Australians' influence on health behaviour. The outcomes of these circumstances are perceived to be overwhelming and prevent health behaviour from being prioritised. Overcrowded and inadequate housing are identified as common barriers to positive health behaviour. Living in overcrowded accommodation is thought to compromise many aspects of health behaviour, including nutrition. The psychological distress created by economic hardship reduce the capacity to focus upon health behaviour and increase the propensity to engage in unhealthy coping mechanisms, such as smoking and alcohol use. Culture, social networks, history, racism, and socio-economic disadvantage, and the psychological distress associated with these factors are thought to affect the health behaviour of Indigenous Australians. Indigenous Australians experience lower income, employment, and educational attainment, as well as home ownership. Risk factors that are linked to chronic kidney disease. Modifiable risk factors include smoking and drugs, alcohol, poor nutrition, and physical inactivity, as well as excess body weight. These factors make Indigenous Australians susceptible to chronic kidney disease. Many Indigenous people face challenges that may increase risk of chronic kidney disease. The accelerated lifestyle changes occurring in communities, socio-economic disadvantage, and limited resources lead to increased risk factors and chronic kidney disease incidence in Indigenous Australians. Non-modifiable risk factors that contribute to chronic kidney disease include age, ethnicity, race, and gender, as well as low birth weight and genetic makeup. The high risk of developing chronic kidney disease include low birth weight, which is linked to reduced nephron endowment, development, reduced functioning, and inflammation from infection, among others. Some risk factors are deemed modifiable, as Indigenous Australians can alter and make modifications to reduce the chronic kidney disease. However, some risk factors cannot be changed, which make them non-modifiable risk factors. The risk factors for chronic kidney disease are highly prevalent among Aboriginal and Torres Strait Islander people. Tobacco smoking, poor nutrition, high blood pressure, obesity, diabetes, and preventable infections are common among Indigenous Australians and have been associated with chronic kidney disease. Barriers to accessing healthcare services include fear and shame, proximity, language and communication barriers, lack of culturally appropriate services, low education and income. People with chronic kidney disease require dialysis or kidney transplant to survive. The method and location of treatment depends on several factors, including a person's specific clinical disease, where they live, advances in dialysis treatment, and the types of services offered at the hospital or kidney clinic. Because of the disruption dialysis causes to everyday life, some patients choose not to receive dialysis treatment. This is particularly the case for Indigenous Australians who have mobility issues due to other illnesses